My name is Brian Dontchos. I'm a radiologist with Massachusetts General Hospital. I'm here to talk about our research where we implemented an immediate read screening mammography program to eliminate unnecessary patient visits after abnormal screening mammograms. We implemented this program during the COVID-19 pandemic in response to guidance from the Society of Breast Imaging that actually encouraged practices to reduce the number of patient visits. We implemented this program in May of 2020. We had an assigned radiologist to read screening mammograms only, uninterrupted, in a dark, quiet reading room, and the results were reported in real time. The patients waited in the mammography rooms for their results. The results were actually communicated through the electronic medical record from the interpreting radiologist to our technologist, who then relayed information to the patients. In most cases, the results were negative or benign, and patients were discharged. In the small number of cases where patients were recalled for an abnormal screening mammogram, every effort was made to actually perform the diagnostic images in real time. We implemented this program over several weeks when screening mammography resumed after screening mammograms were shut down during the COVID-19 pandemic. As we know, there are numerous disparities throughout the breast cancer diagnosis continuum, and we felt that this was an appropriate intervention to attack these disparities. In order to measure this impact, we looked at two equivalent time periods, one 5-month period before we implemented this program and another equivalent 5-month period after we implemented this program. We drew patient characteristics from consecutive screening mammograms performed during regular business hours from the electronic medical record. We then performed multiple multivariable logistic regressions in order to see if there were associations between patient characteristics and if they had a same-day diagnostic imaging exam following an abnormal screening mammogram or not. And so what we actually found was that patients with races and ethnicities other than white had significantly lower odds of having same-day diagnostic imaging following an abnormal screening mammogram with an odds ratio of 0.3. After we implemented our program, this difference went away. So we felt that this was a new paradigm, actually, of screening mammography, and one that is actually sustainable and can be implemented in a varied number of practices. I think the most important and critical element of this is that the rate of screening mammogram performance by the technologist can match the rate of the screening mammogram interpretation by the radiologist. This is the most critical element to maintain an appropriate patient throughput. And given that such a small number of screening mammograms are recalled for additional imaging, these same-day add-on diagnostic exams are quite rare and can actually be fit in throughout the normal diagnostic clinic. Another benefit of our same-day screening mammography program is to prevent the rare but possibly devastating issues where patients don't return from an abnormal screening mammogram. Other ancillary benefits include minimized patient handoffs, reduced administrative time in calling and scheduling patients, reduced PPE use in the hospital, and it also eliminates the possibility of technical repeat examinations because any suboptimal positioning can be corrected in real time. We believe that this program is sustainable as we continue it to this very day. Although in our program we only were able to offer diagnostic imaging in approximately 60% of our patients with abnormal screening exams, we do believe that this can be improved upon, and the full scope and impact of this program has yet to be described. And one of the most important things to note is that our screening performance was maintained. Our abnormal interpretation rate decreased, however, our cancer detection rate and positive predictive value were maintained. So, in summary, we think that this is an outstanding program and offers new insight into a new paradigm of offering care and same-day services and efforts to eliminate disparities in breast cancer care. Thank you so much.